Hi, everybody. It's Nancy Reyes with For Your Canine.
And Joanne Soike with Fur Better, Fur Worse.
Lisa couldn't be with us today. She had a bit of a medical emergency, so she's fine. It's just her family, so she'll I'm sure she'll tune in and see. Let us know you're there. Today we have a treat. One of the big things we always try to talk about or get information about is gut health for the dog as well as for people. So today we have Dr. Odette Suter. Um, she's a holistic vet here in the Chicago area, and so she's going to be talking with us about the digestive health for the dog, and if you have any questions, please let us know. Just put it in the chat box, and we'll definitely try to get to them as promptly as we can. So, welcome. Thank you, Dr. Suter, for being here. Hi, you guys. So,
Thank you for having
how did
me. It's nice
how
to
did
be
you
here.
how did you start in? It seems like you're really into digestion and gut health, which is so important. How did you because you're not a lot of people specialize in things like that. So how did you get into that?
Well, I got turned on to the whole gut thing by Dr. Margot Roman. She's very much into doing fecal transplants, and so she's kind
Oh,
of the pioneer. Not, I mean, she's not a pioneer in that sense because it's been done for thousands and thousands of years. I mean, if you look at dogs, right? They eat poop. So
yes,
they've been taking care of it for, for themselves for a lifetime basically, and for, for a gazillion years. But anyways, the way I got interested in it was really through Dr. Roman, and she sent me home with some poop for one of my patients, and I did a rectal transplant on that patient, and it was just like a miracle.
wow,
He went from having diarrhea for 2 years, and they had already done all sorts of things. They had changed his diet, they had done a food sensitivity test, and he was on supplements, enzymes, blah blah blah. I mean, you name it, they did it. And it wasn't until he got the fecal transplant that basically from the next day his poop was already a lot better, his energy was better, because he was a very high anxiety dog, a German shepherd. And he was theoretically supposed to be a police dog, but because he had so much anxiety and so many health issues, he couldn't be used as a police dog. And so, in any case, once I did that fecal transplant on him and his gut started to feel better and everything, he just was a happy dog.
oh, that's great.
So,
Well, yeah, because that's a pretty that's a therapy in humans too. I was actually not so funny that you mentioned that. There was I was reading an article about somebody who had been very sick and had all kinds of digestive issues, and she ended up doing that fecal therapy for herself, and it was like a miracle. It was like magic. It worked really well. So it's so interesting that you mentioned that, because I um that is a more, do you feel it's a more up and coming therapy now for some?
yeah, I mean, there's a lot of research that's being done in on the subject of the microbiome, which is, for those who don't know, is basically an assortment of microbes that live in and around us. So we have microbes everywhere. They cover every surface that they can get to. Even the brain in humans has microbes in it. So we basically are surrounded and supported by microbes. I call them the little elves, that work at, not at night. They work all the time,
Right.
and they work on every single level. And that's really the fascinating part. And I just did a search today to see how many um, listings or links would come up when you Google microbiome. And I believe it was, can't remember the number, but it was several hundred million,
Wow.
you know, links basically. And I think just in 2018, sorry, it was a lot less. So it's just exponentially increased. There are, every day there are new studies coming out. I'm in the process of creating some lectures for the Holistic Veterinary Conference, and it's like I have probably 100 pages open or windows open because I'm going from one page to another, and it's just so much information that's coming out now. Um, and
Yep.
basically, I think that the microbiome and supporting the microbiome, doing microbiome therapy, is the future of medicine. So medicine, the way it's done today, is not going to be. It's not going to be part of the future very much anymore.
Right. Well, I
So
would go ahead.
I, I was just wondering if you could touch on like the neurons in the gut and how that has like a talking connection to the brain, and therefore that's why I know that's like just high level. No, just kidding. But is it? Can you mention some of those things of like the connection to the brain and the gut?
Yeah, definitely. There's a huge connection, but maybe we should start with, figuring, mentioning how many microbes are really in the gut and, and in and around us. So the microbiome is made of fungi, viruses, bacteria, protozoa, parasites, archaea, which are like more ancient bacteria. And all of these microbes, they send out signals. They basically make chemical compounds that then connect and send signals throughout the body, because basically they connect to the cells of the intestinal lining, and then the cells of intestinal lining, they pass it on. And some of these molecules that they make are neurotransmitters. So there's tryptophan, there's serotonin. 90% of the serotonin that we have in the body is actually in the gut. There's dopamine. There's all kinds of neurotransmitters, and these neurotransmitters, they connect to the nervous system of the gastrointestinal tract, which we call that the enteric nervous system. And so that enteric nervous system then connects to the nervous system, the peripheral nervous system, sympathetic, parasympathetic nervous system, and then to the brain. So there is a connection. It goes both directions. So you have input from the gut microbes and the gut in general that goes up to the brain, but you also have information from the brain coming back down to the gut. And so anytime there is a problem in one area or another, then the signals will obviously go that way or that way, basically. But if there's inflammation in the gut, then that sends signals up to the brain that there's a problem. And the brain also gets inflamed as a result of it, because the gut lining is just one layer of cells on the inside. And then you have the blood and the lymph system right on the outside of that. But in any case, the brain also has a very thin membrane of just one layer of cells. We call that the blood-brain barrier. And that blood-brain barrier is supposed to also be really tightly connected, between the cells. And so if there's inflammation in the gut and these cells are separating, then the same is happening in the brain as well. The cells are separating. And as a result, then all kinds of inflammatory chemicals and things that are not supposed to be in the brain are going into the brain, which then causes problems in the brain. And that's when you see animals that have anxiety, aggression, fears, you name it.
Oh, wow.
Yeah.
Well, yeah, because that's why that's one of the things I wanted you to touch on, which Joanne, like a lot of dogs that come in that have anxiety issues, or whether it be mild or severe, a lot of the more severe cases have a lot more digestive issues. They have chronic diarrhea, they throw up a lot, they have just a lot of more issues than dogs that don't have a lot of anxiety. Not that they couldn't have those problems, but it's not, you don't see it as rare. I usually always ask when I get a case about anxiety what their poop is like, because it gives us a lot of information about the emotional state of the dog, right? They're and they just tend to have more of the digestive issues. Not all, but quite I would say a large number. Would you agree that that's
Yeah, and the thing is, that we are exposed to so many things nowadays that actually cause damage to that microbiome and to the gut lining. For one, we have so much glyphosate, which is the active ingredient of Roundup, floating around in the air, in the water, in the food, and especially foods that are high in legumes and grains are much higher in glyphosate. So we basically are feeding our animals antibiotics because Roundup is an antibiotic, in a sense. It kills bacteria. And so if we constantly feed that glyphosate, then we constantly damage that microbiome. So if they get a dose of glyphosate every day, with the water, with the food, with the environment that they're in, if the neighbor sprayed glyphosate on their dandelion, and then this dog steps on it and then licks that particular area of the body where it stepped on it, then they get even more glyphosate into them. So that's one part. And then obviously there are a lot of other chemicals. I mean, glyphosate is only one of them. But we have sprayed pesticides and chemicals everywhere. I mean, we are living in such a polluted environment, and the microbes are, getting killed in the process and damaged, and certain microbes die off and others then take over because they're a little more resistant. So as a result, then we have more pathogenic microbes in the gut potentially, the E. coli variety, for example, and we have less of the beneficial ones, and we have less diversity because the more diverse the microbiome is, the more different bacteria are in there, the healthier the microbiome is because they all have different functions. Each of these microbes, they have their own little function and they do their little thing. But if you only have a bunch of them of the same variety who all do the same thing, it doesn't really make for a for a system that works all that well. So that's a big problem. And then we have the whole EMF exposure, electromagnetic frequencies. They also cause a lot of damage of the microbes because what happens is the microbes, they communicate with each other and with the body, with the cells of the body via electrical signals as well as chemical signals. And so if we add electromagnetic signals into the mix that are interfering, kind of like a radio that goes, right? The microbes don't know, they get confused and then they don't know what they're supposed to be doing because they're disconnected from the others. They're not,
Communicate.
group. Yeah, they're not communicating. There's just a bunch of them, of yelling going on, and nobody hears what the other one is saying, and so all of that causes a lot of issues in the body. And microbes, or the gut microbiome, has been connected to the lungs, the kidneys, the bladder, the skin, the ears, the eyes, the sinuses, the mouth, the liver, the hormones. I mean, everything is connected, and it's because all these microbes in the gut, they're basically helping every single cell of the body perform better and supporting them in what they need to do. And so if we don't have that support, then
Right.
everything kind of goes haywire.
Right. So going back to feeding, I know there's always a lot of discussion about raw feeding, kibble, home cooked. So what is and I know it's very dog dependent, like what works for one dog may not work for the other. But and I know kibble, like it's hard because finding a good quality kibble is very, very challenging. And I know there was a lot of discussion about kibble grain free that wasn't, so positive. So what's your position on what do you feed the dog to help give him the best nutrition or best digestive health you can?
Just like for humans, for any animal, the more they eat what nature would provide for them, the healthier they can be. So if a human eats Cheerio their whole life or McDonald's food, well, their health cannot be good. I mean, that's just a given.
Right. Right.
So same for dogs. The further away you feed, whatever you feed is, the further away it is from what nature provides, the less likely it is that they are going to be able to stay healthy and thrive and have a happy and healthy life. And, I hear the argument all the time, but, I always used to feed kibble and my dogs lived into their 20s or something like that. Yes, and that's great. But unfortunately, the environment has changed. We don't live in the same world anymore. Since, 1994, since GMO came on the market, and then Roundup was sprayed liberally everywhere and we were all doused by it, there's been a significant increase in cancer rates and all sorts of, diseases. I mean, right now we're dealing with so much chronic disease. I mean, if you look around, it's like everybody's sick to
Yeah.
some degree or another. Most people have some sort of chronic disease, and same with the animals as well. So nowadays, we have to do even better than we did before, just because we are dealing with an environment that's just not promoting health at the
Mhm.
moment.
So, so like for example, for raw feeders, some people make their own, and I
Mhm.
know this is not always a, there's a specific, like you said, a specific how nature intended it. There's a specific formulation, and or not formulation, but how it should be done. And then there's the ones that are already pre-packaged, um, raw food.
Mhm.
So, do you recommend is prepackaged as good as trying to make your own, or is it best to try to make your own raw? Uh,
Well, I mean, if you have time to make your own, I mean, we're all very busy people. Certainly, if you make your own, then you can really pick the ingredients, and you can pick the ingredients, as fresh. So if you're making it fresh, then it hasn't been frozen, so it's even less processed. I mean, certainly that would be ideal. You just have to make sure that it's somewhat balanced, maybe not each meal, but at least the good majority of the meals, so that they have all the nutrients that they need, because we also have depleted soil, so we just need to make sure that we give them what they really need. Um, I mean, certainly if you can do that, but there are a lot of things that can be done to kind of freshen up the food, so to speak. So even if it's frozen food that you're buying, frozen raw, you can always add some fresh vegetables to it. Make a little smoothie right before you give it to them. It'll be full of nutrients. A smoothie, made of vegetables predominantly, and then a little bit of fruit, some berries, organic. It would be even
best.
better, obviously.
Yeah.
And then, feed yourself some of that as well.
Mhm. Yeah.
Um, I mean,
So,
that would be ideal, but not every dog can or cat can handle that. Obviously, some of the older dogs, they need a little bit more support, and
mhm.
it depends on what their GI is, but that would certainly be ideal.
Yeah. So, and do you recommend, because adding like goat milk or fermented kefir or anything like that to their diet too, or does it help or not, or is it
Yeah, it can help. Some animals it helps, some it makes them worse, and that's because their microbiome is out of balance.
okay?
So, if your dog or cat is scratching more after you give them goat milk, or kefir or probiotics or whatever it may be, other fermented foods, then it probably is because their microbiome is out of balance. So fixing that should then make them better able to tolerate certain good foods, because these are not bad foods. It's just that if you have an imbalance in the gut, and your goat milk or your probiotic happens to feed the side that's already elevated, then you just have even more of an imbalance, which then makes symptoms worse. So in those cases, if you have an animal that has a really hard time switching from one protein to another, even if it's the same brand that you're feeding, then most likely the biome is off. If they have reflux, or they're licking surfaces or licking themselves to self-soothe, or they're doing the licking the air kind of thing, usually that's a microbial imbalance as well. Obviously, diarrhea, chronic vomiting, pancreatitis, liver issues, all of these things can be traced back to the microbiome. And, there's a good way of figuring that out. You can test for it, right?
Right.
There is a one company that is currently offering tests for microbiome balance. It's animal biome. They have a kit. All you have to do is just send in a little bit of poop, and then they tell you what's going on with your animal and how you can fix that.
Do you so one of my shepherd has his gut health is, I think, pretty good. He doesn't really get too much diarrhea, or he doesn't get diarrhea at all actually, and he's yeah, he's generally pretty healthy. The only thing, he does have some allergies, um
Mhm.
skin, environmental. So you would still say that his microbiome is off because he has those kind of seasonal
Well,
things.
I would definitely test for it to see
Okay.
what's going on. I would recommend testing every animal, no matter what, because I've had a number of people who wanted to just see what their animal's microbiome was, and their animals were healthy, and they still came back with a significant imbalance. And
Oh,
again, it's just because we're all exposed to these chemicals that damage the microbiome, and a lot of animals were on metronidazole at some point in their life, which that basically decimates the microbiome, or they were on antibiotics or whatever it may be. So anytime they have been on these types of drugs that affect the microbiome, I always recommend doing a biome test to see where they're at, because sometimes they can have a good microbiome and 6 months later it's awful, and they
mm,
may not show any signs of it physically. So if you do that proactively and test on a regular basis, then you can fix it, and that way you can prevent disease from coming
right.
along down the road. And that's the beauty about the microbiome, is that we can test for it, and that we can then prevent diseases, hopefully, from occurring. Hello, here's another one. They all want in,
Yeah. Well,
want to come and talk.
you want to talk about food because that's what they. So it's so okay. So that makes, yeah, because he's gotten a lot better, and like I said, none of my dogs usually have diarrhea or anything like that, but
Mhm.
it doesn't mean that it's not affecting them in other ways and things like that. And so let me ask you, and this is a digestive question. I've noticed that as I've been a raw feeder for a really long time, and I've noticed that some dogs, as they age, they don't really, um, they decide they don't want to eat raw anymore. They're,
Mhm.
I've had to switch to home cooking because they just don't tolerate it, or they really aren't interested in eating it. They've decided they don't want to eat it. Is that a tip normal? I mean, I've had two or three of them that as they got older, it never changed. They still ate
Mhm.
the raw food and it wasn't a problem.
Yeah. I mean, I would always check to see what the underlying issue is. Some older dogs, they also don't make enough enzymes, and they don't make enough stomach acid. So that could be part of it. So it's kind of like, you already feel a little bit, ugh, yeah, and then somebody brings you a bloody steak, and you're like, yeah, I'm not eating that. So, it may just be that they can't process it as well, and they may need a little bit of digestive support. um, and sometimes it's also the microbiome that is off, and they just need to have that kind of fixed. And sometimes it's the hormones too. They may have a decline in hormones, because hormones are important as well for digestion. I mean, thyroid hormone, for example, basically provides the energy for the body to be able to do what it needs to do, and that includes digestion. So if there's not enough thyroid hormone to tell the body, hey, you need to digest your food, let's pump out a little more pancreatic enzymes, and let's get more stomach acid going, then they may, they're a little compromised that way. So I'm always a big fan of testing before treating. I find that's one of the biggest problems, that prevent people from actually getting true healing for their animals, is they don't test for things. They just jump right for a supplement, or they just try to cover up symptoms.
Okay.
Instead of figuring out why is the dog not able to tolerate raw food, or why does it not want the raw food, we then go to cooking food, which obviously you want them to eat. I'm not saying that may not be the right thing, but I always want to know why is
Sure.
something going on. Why is the dog vomiting chronically in the morning? Why is it licking? Not
Right.
just go from, okay, my dog has a symptom of, digestive problems. What supplement can I use? What probiotic can I use? That's
Mhm.
not the right approach, because then you go through 1,000 different types of probiotics and none of them are
Right.
making a difference. 2 years later, your dog still has the same problem or maybe even worse. And you've just wasted a ton of money and a ton of your dog's time, and your dog and you have been suffering that whole time. Whereas if you actually asked the question why and went down the path of figuring out why the problem is there and then fix it, you would have had a much faster, better outcome.
So you recommend, so do you recommend testing, like what are some of the tests do you recommend, like you said, the microbiome test that you can do through the mail?
Mhm. Mhm.
I have that I need to do for my two dogs, but I
Yeah.
probably should do for all of them on that. So, and so how often do you recommend doing it, whether you need it or not? Let's say your dogs are pretty healthy and they're not really having any issues.
I
Um,
probably would do once a year, and anytime there's been some change, let's just say they had something where they had to get antibiotics just to save their lives or whatever it might have been, or they had parasites and needed deworming, or you know whatever it might have been, that might potentially have affected the microbiome. That's also a good time to do it.
oh, okay, yeah,
Yeah.
that makes sense. But yeah, if you're
And
okay,
I had a
so
question too. Since you had mentioned probiotics, right, and just kind of tossing them at dogs, how do you feel about probiotics just on a regular basis to promote, a healthy gut? Is that necessary? Is it not?
I'm not a big fan of probiotics, because the problem with probiotics is that you only have about one to maybe 15 or 20 different species of microbes in these probiotics. And the gut has somewhere between 300 and 1,000 species. So if you're just giving a few, you're potentially creating an imbalance, especially if you give it, for years. So if you want to give probiotics, make sure you rotate. And I would definitely not give it every day. Obviously, if your animal is responding well to a probiotic, that may be a bit of a different story. But in general, I much prefer diversity in diet, where they get a rotation of different proteins, different vegetables, different brands, because then you get microbes from all different parts of the country, basically, because of sourcing of the materials that get into the food. Make sure you go out in nature, because that's where a lot of microbes live as well. Make sure that they get to roll in the dirt and, be dogs and cats.
they
You
do
know,
roll in the dirt.
yeah, yeah. So, let them be dogs and cats, and, let them be out there and roll in the dirt and eat poop. I mean, obviously you have to be a little careful with that, that you don't have them eat poop from a dog that was just dewormed or was on all kinds of drugs and things like that. But yeah, let them eat stuff out
Yeah,
there, as long as it's somewhat safe.
yeah.
Obviously.
So the test is the animal biome test,
Hmm.
right?
Yeah.
That the one you recommend?
Hmm.
I'll
Hmm.
put that in the chat because that's the one I got for my, and it does look very, very simple and
Yeah,
easy
it's easy to do. Yeah.
to do and all that. So yeah. Um
Yeah. And then I do like the NutriScan as well, which is a food sensitivity test for animals that have chronic ear infections, chronic skin infections, chronic GI issues as well, because oftentimes they will have some food sensitivities. So I want to know a little bit about what they can and can't eat, because if I want to restore the gut biome and heal their gut, I want to remove the things that are causing them to have more inflammation.
right,
Because otherwise, it's like trying to extinguish a fire while you're still pouring oil on it, which doesn't make a whole lot of sense.
right. Okay. Yeah, I
And then obviously testing parasite for parasites, because a lot of chronic GI issues can also be parasite related. And parasites can be a little challenging to find because they don't always shed. So they're not always in the poop. So just because they're negative doesn't mean that they don't still have parasites somewhere that might be causing problems.
Mm, mm. Okay. So, let's see. Somebody else had a question. So, Judy says, so how do you fix the microbiome? It's just by feeding, you said rotating,
Proteins and brands and vegetables. I mean, for example, I now have some vegetables that are starting to grow in my garden. So what I do is I take some, I mean, some of them are just really small, but I've planted them so close together that I have to pull out some of them for others to have room. So I leave the roots attached, and I just rinse off a little bit of the dirt because I don't really like the crunch between my teeth of, the sandy feeling.
yeah.
And then I eat the rest. I don't wash them, like crazy, because I want to have some of the microbes that are coming from the dirt. I want to have some of those just naturally, implanted in me. And I guess the other thing I should also have mentioned is stop being super clean. Let go of some of that hygiene a little bit because, well, for one, a lot of these products that we use for, you know, face and washing and toothpaste and God knows what else, deodorants, they're all, loaded with chemicals as well that are potentially damaging to the body. And if you have questions about that, about your product and the ingredients of your product, you can go to the Environmental Working Group website, ewg.org, and they have a place somewhere on their website where you can basically find out whether an ingredient, how toxic it is, basically. But generally, I just recommend dump all the cleaning products and everything. Have just a regular natural soap, a little bit of vinegar, and who needs more than that anyway, right?
Mm-hmm. Oh, that's interesting. Yeah, I see the group there that gives you that information, yeah, about what's in the products, right? Because
Mhm.
yeah, and it's a fight I constantly have with my husband. It's like the stronger the smell, the more he likes it, and it's like no, it's got so much. There's a reason it smells like that. It's too much.
Mhm.
So yeah, I
Yeah.
totally
Yeah.
get that. It's like
And
ugh.
then clean water is important as well because water contains a lot of chemicals that are disinfectants, especially city water. They put a lot of chlorine in it
Mhm.
to disinfect. They put fluoride in it. So you want to make sure that you have a good filter attached that really, cleans them out because these days, unfortunately, the water is like a polypharmacy. So you have people's antidepressant, anti-anxiety medication, their antibiotics, and whatever else goes out through the poop and the urine, ends up in the water system somewhere. Uh,
Mhm.
so making sure that you have really well filtered water, and if you don't have a filter at home, you can get these big 5-gallon jugs that you can refill at the store. Those would be the best option because the stores have uh, what do you call it? Oh, I forget. Oh, reverse osmosis. They have reverse osmosis filtration. So what you're getting is basically fresh water that went through reverse osmosis, so had all these chemicals removed, and it's fresh. It hasn't been sitting in plastic for a century or however long. And a lot of these water bottles, they fill them with tap water anyways, that you buy at the store. So you're just getting tap water. So you may as well drink your own if that's
Yeah.
what you want to do. But anyways, that's the best solution if you don't want to install the filter. But
Mhm.
installing a filter is not that difficult. I have one that's under the sink, and it filters out chemicals, bacteria, pesticides, herbicides, and all sorts of things that I don't want in the water, heavy metals.
Mhm. Yeah, my dogs have what they have water fountains that has filters for the dogs, but I don't have it for myself. So
Mhm.
I have it for my cats because the water fountains, the cats do drink more water if they're
Mhm. Yeah.
uh,
Just make sure the filter is good enough because a lot of filters are not that great. And
mhm.
especially if they are constantly sitting in water, there could be accumulation of certain things that you might not want
Okay.
necessarily.
Yeah.
So,
It's we have to change them a lot, which is the only thing I don't like. Right? They
yeah.
they
Yeah.
require you
Hmm.
to change them pretty often, and I have 3 different fountains for my dogs, so it's
Hmm.
it's going through. But it probably would be better to get the water, filtered water from, filtration system and get that done.
Yeah, probably would be better to have a whole house filter,
Yeah.
because
Mhm.
that way you'd have all three or
Right.
four fountains
So,
attached.
um, if pet owners out there are, and I think money is an issue for a lot of folks, right? And I know some of those tests can get a little expensive. So, if you could name off a couple of top things, what would you tell people? Hey, if you see these things, this is something that might be a sign where you really should spend the money before things could potentially get worse.
Yeah. Get health insurance for your animals and then start working on things. Unfortunately, I understand that, financially it can be a challenge, but if you don't put in the money into your animals, you're not going to get health. Nowadays, unfortunately, it's
Mhm.
gotten a lot worse, and there's not a quick fix to things, but certainly making sure the diet is clean, because that's a foundational piece. If you don't get, if you give them the nutrients that they need, then the cells of the body can function better. And then healing the gut, and if you don't want to do any testing, you can certainly just fix the microbiome with either a fecal transplant rectally or orally with capsules, and then maybe recheck after that just to see if you really created balance. But I
Hmm.
think nowadays we just have to invest a bit of money and energy to
Yeah.
keep them
Well,
healthy.
because and like what Joanne said, Joanne says, because the truth is, whether you spend it buying this, you're going to eventually spend it in trying to treat the dog for chronic illness. So it's
Mhm.
either way you're spending it. It's just
Yeah.
if you're spending it in small amounts or big or big chunks. So
Yeah.
Ronnie had a question. She said, "What pH do you recommend for water? I have a filter that I use that you can adjust the pH."
Well, I think just around 7 probably would be good. I'm not sure that the whole alkaline water thing is really a thing, or beneficial. I think a lot of these water companies that use or promote alkaline water, they're multi-level marketing companies, so one has to kind of wonder. At least from what I've done research-wise, with water, it doesn't seem like it's the best. I mean, it's necessary. Let's just say that. I think
Mm,
filtering out the chemicals is more important.
okay. Okay.
Yeah.
Uh, what was my other what was the other question I had? So yeah, they're asking about the test. They're asking about that. Um, and you rotate. So do you recommend starting to rotate proteins when dogs are young? Like I have a young lab who's 8 months old, and I have started rotating proteins. Do you recommend doing it young so that you're not shocking their system when you do it too much older? And what's the best way to do that with an older dog, right?
Yeah. So with puppies, I usually get them started out on a raw diet and rotating things right away. But I will add some digestive support because, uh, in the wild, the puppies would be getting food that mom brings home. And what mom does is she ingests the food and then she comes home and she goes, "What?" And then you have a pile of pre-digested food, and that's what the puppies eat. So I like to mimic that by adding digestive enzymes to their food so that they can actually digest it better. So that's one thing. And then I also like to add some goat milk, some colostrum, just to basically support their immune system. And then all of my puppies go home with fecal capsules. So I already put them on a fecal transplant basically as soon as they show up at my door, because I want to make sure that they start out with a good microbiome, because we don't know what mom's microbiome was. We don't know how
Mhm.
much, what she was exposed to, because they get their microbiome from mom, when they're born, and then from the environment that mom lives in. But depending on what the breeder or whomever, created that little puppy did in their environment, the microbiome may be quite damaged already. And top of, add to the list some, metronidazole and dewormers that these puppies get, and then they get 20,000 vaccines, and so they're already getting quite the insult, for,
Yeah.
from very young. And so you want to make sure that you support them as best as possible so that they can have a good start, because if they have a good start, then they're probably going to have a good life, or they're more likely than if they have a bad start. So that's what I do. So I focus on all the things that will help to support their immune system, their gut health, so that their body can be healthy. Because again, I want to get back to the microbes. These microbes, they basically run the show. They outnumber the genetic material that we humans have by a factor of 150. They're outnumbering us, the cells of our body, by a factor of 1 to 10, depending on whether we just went to the bathroom or not. So they run the show. So if you can put these microbes in there that are running the show is going to go well, most likely.
Mm.
But if you don't, then you're going to have things that start breaking down because
Right.
they're missing.
So, let's see. Lori asked, "Do you get the fecal capsules from Animal Biome or somewhere other place?"
Yeah, I get the raw ones. They have some that are from kibble fed donors and some from raw fed donors. So I get the raw fed donor dog capsules
Mm.
or cat capsules. Well, I don't know if they have raw for cats. I don't take care of a lot of cats these days.
Well,
So,
it's just interesting because I'm thinking about it for my 16-year-old cat. He has always had digestive issues all the time.
mhm.
He's not a really nervous cat, but he's had some. If he eats anything that's not right, he'll get sick. So Judy had a question. What digestive enzymes do you recommend?
For puppies, I generally recommend the kind that contain pancreatin in them. So they're usually pork based.
Hmm.
If an older animal can tolerate those, I will use those as well. If they have a sensitivity to pork, obviously I won't use those. Then I will go for plant-based enzymes. But yeah, usually pork, and you can also just buy pancreas and grind it up and add it to the food. That's another option as well.
Hmm. And how about and for an older dog, an older or middle-aged dog, this is the same?
Yeah, same.
Okay. All
Yeah,
right.
yeah.
Yeah, that's a yeah, I don't use probiotics a lot or consistently,
Mhm.
so I probably should, or not. You're saying not to use too much, not to use because they only.
You know, research is not really that great as far as results are concerned. I mean, there are certainly animals and humans that do well on probiotics where they actually are helped, but for the most part, is like you don't really see a difference. And I I used to carry probiotics. I used to give them out to everybody who came in, and I didn't really ever see much of a difference. And so about 4 years ago, I just stopped selling them because I'm like, well, what's the point? If I have fecal capsules that I can give that are going to be doing so much more,
Mhm.
I mean, probiotics is like a drop in a bucket. Giving a whole microbiome, you're giving the full bucket. You're giving it the whole thing, So, just go for that and don't waste the money on probiotics. And the problem is too that these probiotics, they can have strains in them that can promote inflammation and others that decrease inflammation, but you're not going to know which ones they are unless you call the company and figure out what they're actually putting into their probiotic, because it doesn't say it on the label for the most part. You know, it may say Lactobacillus acidophilus, but those get broken down into strains of acidophilus, and some of them will be pro-inflammatory and others will be anti-inflammatory. So you're going to have to find out which is in that product that you're getting.
Right.
And yeah, again, it's like, I don't like to waste money. I like to just go, I don't beat around the bush. That's what makes me a really bad storyteller. I just right to the point. And it's the same with you know, medicine, with treatment. I don't waste money. I don't waste people's money.
Yeah.
You know, if I recommend something, it's because I know I'm going to get information out of that will then help me to figure out a treatment plan for that particular animal that is actually going to be the most efficient that I can come up with at this point. You know, I mean, obviously we always learn more, right? But
right. So could you talk a little bit? I know we talk a little bit about a fecal transplant, what that is. I know they do it for people a lot.
No, actually, no.
They do it. They're starting. It's a very new thing, and and they're still in the infancy. Because I was reading that article, that woman who did it for herself. Did it. It was an interesting process of doing that. I don't know if I'd do that, but yeah, I don't. I was just wanted you to kind of talk a little bit about that.
Yeah. Well, when we talk about you know, fecal transplants, you know, got to have the right attire, right?
That's great.
Yeah, well, you know, that's what I wear when I do the fecal transplants on my animal patients, because that way it kind of gets people laughing, and that helps to put them more into a parasympathetic mode, which is more the healing, relaxing, digesting sort of mode. So then, you know, anyways, just having fun.
That's great.
But yeah, fecal transplants are not approved in the United States unless you have a C. diff infection, you've been on a few rounds of antibiotics, you've almost died, and then they bring out the poop that is 90% effective, whereas antibiotics are not. So I'm like, okay, whatever. But anyways, they're still very restricted as far as doing fecal transplants. And I think that's why a lot of people are just doing it on their own. They're finding their own donor and they just do it.
Yep.
And it's not rocket science. All you need is a little tube or an enema bag and you know, mix it with some saline and in it goes. I know it sounds a little disgusting, but you know, if it's that or being really sick,
yes,
you know.
Yeah, because I've seen that's what it was. It was on. It was somebody who had C. diff. That that she did it herself with her husband's.
Yeah, well, good for her, you know, because it's like, are you just going to wait for your doctor to let you die before they're even going to try? I mean, come on.
Right.
I mean, that's just crazy. But in the animal world, we don't have restrictions. I can do a fecal transplant on any dog, no matter what, whether they're sick or not sick, or, you know, no matter what, I can do it. You know, there's no restriction in that regard. So I do them quite frequently. I used to do them more rectally. Now I do a little bit more capsules, just because it seems like that's what people tend to want more of. But it's really easy, you know, even rectally. They don't need a sedation. They don't need to be put under anesthesia for it. If they can tolerate a thermometer in their butt, they can tolerate the fecal transplant just fine. Cats may be a little more challenging. You know, if you have a fractious cat that won't let you do anything, then, you know, you may need to sedate them a little bit. But dogs usually are not a problem.
Yeah.
I mean, unless you have a dog who also won't let you do anything, but
and the fecal and the purpose of it is to bring in a healthy microbiome into a currently not healthy gut, or, you know, And usually the healthy microbiome takes over. Is that the goal of that?
Yeah, that's the goal. And there are other things that come with poop as well, aside from microbes. And it's all the byproducts that these microbes make that are very beneficial and very healing. So when you do a fecal transplant, you also give them a lot of these these molecules that help the body and assist the body in healing. Because for C. diff infection in humans, they've strained out all the microbes out of poop and then put the rest into the people, and they still had good results with the C. diff, even though there were no microbes left in the poop or in what they put in. So it's not just poop, it's also all the biochemical compounds that these microbes make that go out through the poop that also are beneficial. And that's why, for example, in dogs that are pregnant or lactating, they will have a much better poop. They will be better donors during those times than when they're not, for example, because there are a lot of nutrients that also come with the poop. Yeah. So obviously it's important that you find a good donor dog. So you don't want to just take your neighbor's dog. You want to make sure they're screened properly, that, they check all the boxes, that they're healthy, because obviously you don't want to put an imbalanced microbiome into the animal.
Oh, right.
Your
pet. Then you're not so let me so this is just an interesting question. So if you have a dog that has anxiety issues, that has an imbalance in the microbiome, and let's say you take a balanced microbiome, have you ever seen, or even by accident, that dog become less anxious or less, or just better in that regard?
Yeah, like that German Shepherd that I mentioned earlier, his anxiety level went way down, and he had a lot more energy. So definitely, it can make a difference. But I also have to say that nowadays, a lot of animals have so much anxiety and so many behavior issues like never before, and sometimes it's just so severe that you need to address it in a different way as well.
Yeah, you know what? It just thought of that. Like for the just dogs that tend to be anxious, just if doing that procedure would help reduce some of that anxiety, that would be very, very interesting, because most of those dogs that have that anxiety do tend to have more,
GI issues, yeah.
yeah, GI issues. I'm in my experience, that's been what I've seen, a lot of that. So that's an interesting, I don't know, thought treatment. So.
The question there is always, chicken or the egg, which came first? Because stress can also significantly affect the microbiome. It can damage it. So, depending on what happened. I mean, if you have a dog, for example, who was traumatized in their life, who was abused, and if they have anxiety, I doubt that you can necessarily fix it with a biome, because there were memories that were created that then stayed with the animal, and over time they may be able to let go of some of that and find more trust and joy again. But there are certain things that can certainly benefit, and I think that overall the body is always going to benefit from having a good microbiome, whether it fixes anxiety completely or aggression or whatever else it may be. That remains to be determined based on, let's try it and see what happens, right?
Yeah, right. Because it's just an interesting thought. So let me ask you because I wanted to talk about your program too, but I wanted to ask you, like, let's say somebody can only feed kibble, they have no, they're not able to do raw for whatever reason. How can they make kibble? Would they do this? Would you suggest the same thing? Put some vegetables in there and all that to at least help offset it a little bit? Is that something that would?
And even if it's, if you can't do fully raw, if you can do like 50%, one meal a day raw, or a few meals per week, I mean, that's certainly better than nothing. But again, the thing is that we live in an environment that's already not health promoting. So focusing on a good diet and doing everything you can to improve that, I think would be important.
Right. To put in, yeah, at least be able to put some veggies in or
Mhm.
whatever to help.
Yeah, and there are other veggies than green beans.
Yes.
It's like everybody is doing green beans. I'm not a huge fan of green beans, frankly, just because they're legumes.
Yeah.
They tend to have a little bit of lectins in them, which can cause a little bit of disruption of the gut lining and such. So use other things. Dandelion greens are great. Obviously, make sure that nobody sprayed them. They're growing everywhere right now. Um, Other types of green vegetables: kale, Swiss chard, spinach,
Mhm.
fennel, celery. Herbs, you can add a little bit of herbs, once in a while. I mean, obviously, anything that has more flavor, you want to be a little more careful with those because your dog may then not want to eat the food. Uh,
Mhm.
and yeah, try to go organic if you can, just because you don't want to add more chemicals.
Right. So Lori was asking, do you think that green juju product, I have not heard of
Mhm.
that. Can
Yeah, it's good. Yeah, I like.
green juju? Okay.
Yeah, I like them. They have good greens, and they also have some fermented versions of things. So
Okay.
yeah, I like green juju.
So and somebody asked about freeze dried raw. I know that's not the same as raw, but is that
Well, it's still better than kibble.
okay?
But if you're thinking about money, freeze dried is always going to be more expensive than
Oh,
going raw,
yeah.
just because it's a different process.
Yep.
But there are certain dogs, especially of the smaller variety, who just won't eat raw. They just go on strike. So for those guys, freeze dried can be a good option.
Hmm.
For dogs that have a lot of GI issues, sometimes I will switch them over to a freeze dried first, because for some reason it seems like they're digesting it a little bit better. Um, and then as their digestion gets better, switching them over to raw diet.
Hmm.
Yeah, freeze dried is a good option too. Just make sure it's not the really cheap kind, because the less expensive it is, the more carbs it will have. And carbs are more pro-inflammatory. And dogs don't really need carbs. In nature, they don't get a lot of carbs.
Right.
So you want to definitely be on a low carb diet. And the way to figure out carbs, because they're not on the label, on a human food label, there's fat, protein, carbs, ash, moisture, or whatever else. On the guaranteed analysis, and dog and cat food, they will never mention carbs on there. So what you have to do is just add the percentages, and then whatever is left to 100 is basically the carb content.
Oh, well, all right, guys, you have to do math, but that's it's
Yeah.
not that bad. Yeah. Oh, that's really, I never even because I mean I don't really look at that because I feed raw. So let me ask you for the raw, do you recommend changing I know proteins, but also manufacturers?
Yeah.
Okay.
Hmm. Yeah. Yeah.
Yeah. Okay. Yeah, because I mean, because I go between three different, but it's always good to even add other
Mhm.
ones, right?
Mhm. Yeah, and then feed a little bit of your own food. The people are so worried about feeding from their own plate. Obviously, if you eat junk, don't do it. But if you're eating a good diet, give your dog a little bit of your own food.
Yes, salad and
Yeah.
like that. Yeah,
Yeah,
my
whatever they may like. I mean, there are some dogs who love vegetables, and others are like, yeah, no, I'm not eating that.
well, I have two labs, so they get a lot of vegetables because they really want to be fat labs. they they really are. They like to eat, so we add a lot of veggies to their Uh,
Okay.
so, um, so doctor, you mentioned that and a lot of you have probably found that finding a holistic vet is really hard, or finding a vet in general is very, very challenging.
Mhm.
There's not as many of them. So, Dr. Suter has come up with a program to educate, people on how to maybe support the dog's microbiome and all that. I mean, it's a process, but um, could you talk to us a little bit about that? Oh, and Dr. Suter also has a book called
What your vet never told you.
Vet Never Told.
And there's more to it, but I can't remember the
Yeah,
rest.
exactly. No, there is more to, and I was looking through it, and it's just a lot of great information. But she's trying to bridge, which is challenging, bridge the shortage we have with um, vets and trying to get into the vet because sometimes you can't get in for a long time, and be able to then get the information so you can start working with your dog until you can get in to see your vet or whatever. And I thought that's just brilliant because it is, even for me, trying to get in to see my holistic vet and then my regular vet. And even though it's challenging to try to manage all that, and sometimes you need just some information. So I was very curious about that, about your
Mhm.
program.
Yeah, so people are out there educating themselves more and more. So the gap between the knowledge that a veterinarian has and what the pet owner has is getting smaller and smaller. People are getting more and more educated. And I think that because of that shortage that we have, people are forced to educate themselves because they can't get the answers because, their veterinarians just don't have enough time to educate them. It's a sad reality, and I don't think any vet is doing that on purpose. It's just that
Right.
we're overworked and we don't have enough staff and such. So in any case, I think that the pet parent, 2.0, as some people will call them, they are educated pet parents. They get information themselves, and they basically take over the care for their animals, at a higher level than ever before. And so what I'm doing is I'm helping with that so that people get a bit of a shortcut, because nobody has time to spend 5 hours a day on the internet learning things. So I've basically condensed the information that you as a pet parent need to have in order to be able to provide the best care for your animals. So you get that information, and then at the same time you also get live sessions where I then talk to you about your animals and what to do next, and looking at lab results and helping you understand what they mean, and answering any questions that you may have that are a little bit more difficult to get answers from your vet. So I'm trying to kind of bridge that gap a little bit, and take off a little bit of the work off of the workload off of the veterinarians, and at the same time I'm trying to provide some information for the pet parents so that they feel more comfortable, because one of the biggest frustrations I get from people is that they're overloaded with information. They don't know what to do with it. They
Mhm.
have all of that information, but they don't know how to put it together. So I put it together so that you can then learn to think like a holistic vet and proceed that way. And obviously I'll be continuing to support you in whatever you need, but I want people to be able to know what they need to do in order to maintain health and create health for their animals. So
Mhm.
that's basically what I do with this program.
What's your website? I think I found
It's Odette Suter DVM.com. So first and last name DVM.com. That's my website.
AVM. Yeah, that's what I found. That's what,
Yeah.
so I put that on there. Um, yeah, because it's really helpful because like I always have a lot of questions about
Mhm.
how many, because my current vet told me to about supplements. I used to be religious about always having to putting the supplements all the time, and he recommended sometimes you put them in, sometimes you don't. You kind of mix it up as long
Mhm.
as they get it during the week. They would, and feeding a good diet would then
Mhm.
they'd eventually get it all instead of me being militant about putting it making sure every single time they get that supplement. So I've gotten a little bit better about that. So,
Mhm. Yeah, good. Very good.
yep. Okay. Thank you so much. That was a lot of information. But it's the thing is, it's really the having that the digestion is huge, and
Mm.
when you have people dealing with dogs, no, dealing with dogs digestive or diarrhea all the time or on a regular, it's very stressful. Tango, come here, come here. It's very stressful for folks, and it just becomes a vicious cycle because you started to give them all these different things, and then it becomes a bigger problem. So,
Yeah,
um,
plus, with supplements, it's also that they're not just harmless.
right,
If you're giving them supplements and they don't really need that particular supplement, you can
right,
actually do more harm than good because they still have to process that supplement. And I was reminded of that myself. I started working with someone with hormones because I'm kind of at that age, right, where I need a little bit of
amen, sister. Yeah,
support that way. And I started to feel really depressed and mopey and didn't want to move and just procrastinating. And I'm like, that's not me. And I realized it was some of the supplements that were causing some issues for me. And so I stopped quite a bunch of them, and that I was prescribed, and I started feeling better again. So just because it's a supplement doesn't mean it's harmless.
right,
So I think it's really important to know that. And again, you also don't want to waste your money. You only want to use what you really need to.
right,
Minimal effort for maximum
right.
result.
Well,
That's kind of my
it's
motto.
funny that you mentioned that because I went through. Was taking some supplements and actually it did quite a number on my liver, and I ended up in the hospital for a week. So I am I
Yeah.
100% agree that supplements sometimes could do more
Mm.
harm than good. Yeah, my liver could not process that supplement, and I ended up in the hospital for 1 week. You know, trying to save my liver. So it
Oh,
was an
sorry to
interesting
hear that.
little. Yeah, it was an interesting uh, because
Yeah.
it was like not just out of the blue. I don't usually have those problems. Anyway, all right.
Mm.
Well, thank you so
Yeah.
much,
Yeah.
Dr. Suter. I really appreciate all your help, and everybody was really
Yeah. Thank you.
had a lot of questions, and we'll look forward to seeing you again. It was great. Thank you.
Yeah. No, thank you so much. And thank you guys all out there for doing all that you do for your animals. You're the ones who are changing the face of medicine. So keep up what you're doing.
Thanks. All righty.